Welcome. And Minister and dignitaries, board members, chairs of boards, but most important of all, people who actually work hard in the New South Wales health system. No, bad board members do work, do they, Minister? Okay, fine. Okay, good. We do fantastic work. And I've been a serious consumer of the New South Wales health system over the last few months, and I can tell you, regardless of the headlines that you see in the press, it is unbelievable the care that you give and the innovations that I have seen, particularly at the nursing level in New South Wales Health. It is just truly tremendous. And some of the finalists that we're seeing today reflect that hard work. And of course, today is about contagion. It's not just good enough to innovate. It's not just good enough to be successful at your innovation. It's got to spread. And that's what today is all about. Just some housekeeping. If you could turn your phones to silent, that would be great, but don't turn them off because we're actually going to need your phones, and I'll explain more about that later. Emergency exits are behind the screens there behind you, and we'll have a meeting area, and an emergency will be outside the building itself. Throughout the symposium, the toilet facilities are available, again, mostly behind those screens. The plenary sessions and the breakouts in room 3 will be live streamed on the New South Wales Health intranet. If you do not wish to be filmed or photographed, in other words, you've told somebody you're somewhere else, let us know, and we'll put a big red dot on your forehead so that you're not, seriously though, just if you do not want to be filmed, please let us know. Our exhibit sponsors really help to make this happen and be affordable, and it's terrific that they're exhibiting. Please show your support to our exhibitors by attending their booths, particularly the Make Healthy Normal bike ride, because you're going to need it after sitting for a while. We also have displays of our 2016 finalists, and the Yellow Brick Road takes you through the last 5 years of award winners, again illustrating the fact that innovation doesn't sit still, it moves on and it spreads, and you're going to hear more about that over the next day or two. And you're going to hear profiles of the finalists as we go along, and that will become clear quite soon. If you will have picked up your finalist program when registering, check out the QR codes and visit the New South Wales Health Symposium website for even more information about these amazing projects. And the hashtag for the conference is hashtag New South Wales Health Innovation. And don't forget to share on your own social channels so that the message spreads far and wide. We're going to be using Slido to actually ask questions, as well as you asking questions from the floor, and I'll explain more about that later when it's been explained to me. More on that in a moment. And the People's Choice Award is up again this year. Again, a great reason to explore the 2016 New South Wales Health Finalists area and learn about the projects, and don't forget to vote by putting your card in the barrel by lunchtime tomorrow. We have a breakout room with some great presentations and the programs at the back of your on the back of your lanyards. If you have a coloured dot or interested in one of these sessions, you make your way at the key junction points, which is not just yet. But I've spoken too long. It is important, not just respectful, it is the right thing to do to acknowledge the traditional owners and the custodians of the land on which we meet, and elders present, elders past, and possibly most important of all, elders who are emerging and the elders of tomorrow. And to welcome us to country, I'd like to invite Uncle Chika from the Gadigal people, New South Wales, to welcome us. Thanks, Uncle Chika.
Good, thank you. Good afternoon, folks. My name is Charles Madden, but known around the inner city of Sydney as Chika. Now that's a nickname that I got many, many years ago, going to Redfern Public School, which is now NCIE, the National Centre for Indigenous Excellence. Folks, I'm from Gadigal land, Aboriginal land. I think this afternoon we're on the border of the Gadigal and Wangal country. The Gadigal and Wangal are 2 of 29 clans that make up the Eora Nation. The Eora Nation is bordered by 3 distinctive landmarks. We have the Hawkesbury River to the north, Nepean to the west, and the Georges River to the south. Those 3 rivers form the boundaries of the Eora Nation. Folks, for many, many years I've been involved with different Aboriginal organisations in and around the city. I've been a director with the Aboriginal Medical Service at Redfern for over 40 years. Also a director with the Redfern Aboriginal Housing Company, Aboriginal Hostels Australia, and the Metropolitan Local Aboriginal Land Council, where I am still a very active member. I've got to mention it, folks, also a life member of the Redfern All Blacks Rugby League Football Club. Folks, for many, many years, I've lived and worked around the city of Sydney. I'd like to take this opportunity this afternoon to extend a warm and sincere welcome to any of my Aboriginal brothers and sisters, non-Aboriginal brothers and sisters, who may have travelled here onto the land of the Eora people. If we have any brothers and sisters from the Torres Strait or further afar across the seas, welcome. Welcome to the land of the Eora people. Enjoy your stay. Have a safe and trouble-free trip home. Once again, welcome, welcome, welcome. Thank you. Enjoy the evening, folks.
Thanks, Chicken.
Thank you, bro.
Thanks, Chicken. That's great.